Assalamu alaikum. My name is Sayyida Aisha Kasmi. I'm from 4th Prof Morning, and today my topic is about pruritus. Now, let's see what is pruritus. Pruritus or itch. Pruritus is basically an itching sensation or something that erupts or provokes the itching sensation on the skin. It is a characteristic feature of many skin diseases. That means that skin diseases, the underlying skin diseases, or the systemic skin diseases, or the skin diseases that are visible on skin, can be identified by itching or pruritus. Okay, there are pruritus may be localized or generalized and can occur as an acute or chronic condition. Itching which lasts 6 weeks is termed as chronic, while itching that lasts for 2 weeks or 1 week is called acute. Now, if you see here, acute phase and chronic phase. In acute phase, the neutrophils are only acting on the sensory neurons. There are only neutrophils, but in chronic phase, when the itching is progressing, there comes basophils, eosinophils, mast cells, and neurophils that are acting on sensory neurons. Pain and what you call itch, they both create different reflexes. Pain creates a withdrawal reflex, where itch creates a scratch reflex. If something provokes, if any disease provokes itching or pruritus, the person is prone to scratch himself. Okay. When the pruritus is very minor, or you can say very minimal, so the person scratches himself and the person feels relief. But in chronic conditions, a person cannot scratch, because in chronic conditions the disease is much worse and scratching cannot reveal it. So we relieve it. So we use topical medications to stop the scratching and many things, corticosteroids, topical corticosteroids, and different things to relieve it. Many medicines can be used, antihistamines can be used to suppress the scratching. Now, mechanism. Itch can originate in the peripheral nervous system, that includes the dermal or neuropathic, or in the central nervous system, that includes the neuropathic, neurogenic, or psychogenic. When there is no identifiable cause, it is known as essential pruritus. Pruritic, if you can see the picture here I'm showing, it's like pruritic mediators in neuropathy. And the glass wool fiber is the irritant, or the one that is provoking the itching sensation, or the neuronal injury that is provoking the itching sensation. Now there are four types of pruritus. So let's see. First is dermal pruritoceptive. Dermal pruritoceptive itch originating in the skin is known as pruritoceptive and can be induced by a variety of stimuli, including mechanical, chemical, thermal, electrical stimulation. The primary efferent neurons responsible for histamine-induced itch are unmyelinated C fibers. Now let's see the other ones. Neuropathic, neurogenic, psychogenic. Neuropathic itch can originate at any point along the efferent pathways as a result of damage of the nervous system. Neurogenic itch, which is itch induced centrally but with no neural damage, is mostly associated with increased accumulation of exogenous opioids and possibly synthetic opioids. Now, if you see psychogenic itch is also associated with some symptoms of psychiatric disorders such as tactile hallucinations, delusion, parasitosis, or obsessive compulsive disorder, OCD, which basically signifies the urge to clean everything, or a disorder which is very obsessed with things. Now, causes. Now, if you see the itching sensation is provoked, and it can be provoked by many causes. So first cause we are discussing here is infections. Infections are the primary thing, or the primary baseline which causes pruritus. Now, infections include body loose, cutaneous larva migraines, head lice, herpes, insect bites, pubic lice, scabies, shaving or swimmer's itch, like etc. Now, environmental and allergic. Environmental things like allergic reactions to contact with specific chemicals or with some irritant in the environment, like photodermatitis, sunlight reacts with chemicals in the skin, urticaria, which are called hives, can cause itching. Skin disorders are also play a very important role, like dandruff, keratosis, punctuate, pulmoplantar ketoderma, a group of disorders characterized by abnormal thickening of the palms and soles. So these all infections, environmental and allergic skin disorders, they can provoke and they provoke the itching sensation and signify that there is a problem on the skin. Okay. Skin conditions such as psoriasis, eczema, seborrheic dermatitis, they are major skin disorders and very prone to um, itching. They are very prone to itching, and something is happening, like itching is happening non-stop. You have to, suppress that, but the itching is happening, and this signifies that you have any serious disease like psoriasis, eczema, seborrheic dermatitis, sunburn, athlete's foot. So xerosis, dry skin, the most common cause, frequently seen in the winter and also associated with older age, frequent bathing in hot showers or baths in high temperature and low humidity environments. Other medical disorders include diabetes mellitus, which is a systemic disorder, and if the itching is occurs, so maybe the person is suffering from DM, hyperparathyroidism, iron deficiency, anemia, jaundice, cholestasis, bilirubin, lymphoma, Hodgkin. These are the systemic disorders that may signify or that may provoke the itching sensation. Now the soap notes. If a 17-year-old boy presents to a dermatology clinic with 30% of his body covered with pruritic or eczematous rash, or maybe the person is suffering from dermatitis, so what we have to do, what is the plan and assessment, or what we have to plan to suppress that? Let's see. So objectives as stated, the 30% of the boy's body is covered in itch marks per pruritus and rash. What would be the assessment and plan for his treatment? Assessment. Pruritus itching is the most common cutaneous symptom and is associated with a variety of systemic disease. In the absence of a cutaneous manifestation, a careful history and physical examination should be performed to rule out one of the systemic causes of pruritus. In addition, a chest radiograph, stool examination for occult blood, complete blood count with differential thyroid panel, blood urea nitrogen, creatinine liver function panel, glucose, and urinalysis may be necessary to help screen for the aforementioned systemic diseases. Plan. What is the plan, or how we gonna suppress the pruritus, or how we want to eradicate the pruritus? Topically applied local anesthetics like benzocaine, lidocaine. Pruritus or pain may be reduced up to 45 minutes. Cold water ice cubes, they cause vasoconstriction, as do products containing aluminum acetate, borose solution, tannic acid, calamine. A cool bath may be useful for the relief of pruritus from dermatological lesions if they are widespread. Moisturizing mixtures, the Kelly lotion, Lubriderm, or simply mineral or baby oil are useful in the treatment of pruritus caused by dry skin. The problem is often encountered in the elderly and other during the winter months. Bathing. Bathing should be restricted to avoid washing away normal body oils and the drying effect of water, the irritant effect of alkaline soaps, and the trauma of toweling. Topical corticosteroids applications can be very, very effective, and in most cases, topical corticosteroids are applied, which reduce the effect. Systemic antihistamines in the form of tablets like Pritix, and or it can suppress allergy, which evokes the itching sensation. And many consider hydroxine with a dose of 10 to 25 mg 3 to 4 times a day. Doxepin, a TCA, tricyclic antidepressant with potent H1 blocking properties, is valuable as second line antihistamine. That would be all. Thank you so much, and Allah Hafiz.